Hi Meg, I'm Nurse Cal.
Hi, Cal.
What brings you to my office today?
So, Cal, I've been diagnosed with COPD, and I just wanted to know more about it and if there was anything that I could do to improve my health and like how it's treated.
Oh, okay. I'm really glad you came to see me. It's my pleasure to help. COPD stands for chronic obstructive pulmonary disease. COPD is a preventable and treatable disease with significant extrapulmonary effects that can contribute to the severity from patient to patient. It is characterized by limited airflow that is not fully reversible. The airflow limitation is progressive and it pairs with an abnormal inflammatory response within the lungs to noxious particles or gases. So you may have noticed you're more, you have a high sensitivity to like perfumes or cigarette smoke now maybe. Any respiratory disease that persistently obstructs bronchial airflow falls under the broad classification of COPD. It's a condition of chronic dyspnea with expiratory airflow limitation that doesn't fluctuate drastically. Within the broad category, the primary cause of the obstruction may vary. For example, it may include airway inflammation, mucus plugging, narrowing of airway lumens, or complete destruction of the airway. The term COPD mainly involves two related diseases, chronic bronchitis and emphysema. Although chronic asthma can also involves the airway inflammation and periodic narrowing of the airway lumen, the condition itself is a result of an individual's response to a wide variety of stimuli and triggers, and is therefore episodic in nature. It fluctuates, and the symptoms fluctuate, and there's exacerbations. COPD is a general term for a chronic lung disease. That means that you have to deal with it for the rest of your life. Cigarette smoking is the most significant risk factor for COPD development and progression. Smoking plays a central role in developing this disease and promotes the loss of lung function over the lifespan. Other risk factors include inhaled pollution, which we don't experience too much of here in Canada, reduced lung development, or severe lung infection during childhood. The coexistence of asthma and being Do you smoke?
I do. I've been trying to quit, but I'm having a really hard time. I keep coming back to it. I know I should quit, but it's really hard.
Quitting smoking is really challenging for everyone. Everyone's experience is very different on how they cope and how they get through it. It's very tough. But it is essential that you quit now that you've been diagnosed with COPD. I have a pamphlet that I'll give to you later on common therapies used to help quit smoking, such as nicotine replacement therapy, where you could have nicotine gum or a nicotine patch that you use whenever you're really craving a cigarette. That also can include things like the new vapes that they have.
Okay.
This is a form of therapy. You still get your nicotine to fulfill all your cravings, and it's healthier than smoking. You should also try to find ways to distract yourself when you're experiencing your nicotine cravings.
Okay.
I suggest maybe going for a walk, chewing gum, doing some deep breathing exercises, something to clear your mind and get your head off it. You can also join some online groups with other people who are trying to quit smoking as well. Quitting smoking isn't easy, and it's a lot harder to do on your own.
It's true. Thanks. I'll be sure to check out these new strategies. The doctor prescribed me Spiriva and Ventolin inhaler. Could you tell me about these?
Yeah. So Spiriva is a bronchodilator that is often prescribed to people diagnosed with COPD. Spiriva dilates your bronchioles, so it opens up your airways and allows you to breathe better. Spiriva is taken daily as a maintenance drug. A common side effect is usually dry mouth, and a runny nose. Ventolin is the fast-acting drug.
Okay.
You take it whenever you have an asthma attack. So when you feel like your chest is tight, you can't breathe, that's when you take the Ventolin. To take the Ventolin, you can use a chamber or by having it 2 fingers widths apart while exhaling. So you have
My inhaler,
your
yeah.
inhaler, and I have my demonstration one. So you want to hold it 2 finger widths apart from your lips.
Okay.
But you want to shake it first.
Okay.
Hold it 2 finger widths apart.
Yeah.
Exhale. And then as you inhale, press it.
Okay.
Hold for a second, and then let go.
Okay.
After you use it, you want to rinse your mouth with water. This is because you can develop like an oral thrush if you do not rinse your mouth afterwards.
Okay.
So we'll try it again. So you go, shake it up, 2 fingers, exhale, press and inhale. Hold. And that should relieve your signs of an asthma attack. And
Okay.
symptoms. What did you think of that? Is it easy?
Well, it really clears things up. Is there anything else I could do to improve my condition?
I see in your medication list that you take an anti-anxiety medication. We will need to change it to one that isn't a sedative. These have a tendency to depress the respiratory drive and protective cough mechanism.
Okay, that doesn't seem too difficult.
No. I'd suggest you start doing some light exercises, such as going for a 30-minute walk a couple times a week.
Okay.
This will help improve your cardiovascular health and improve your lung capacity.
Okay.
Every week you should aim to go just a little bit longer, and since winter's coming, maybe you could get a gym membership and walk around a track there, or use a treadmill, or you could go to a mall and walk there and just do laps around the mall. You shouldn't walk alone, as you may have an asthma attack, and you shouldn't be alone when that happens.
That's a great idea. I live just 5 minutes from a mall. I'm definitely going to start doing that. It's very helpful information. Thank you.
You're welcome. It's a pleasure having you, and come back in a couple weeks and we'll check on you then, okay?
Okay.
It's been 2 weeks. Hey, Meg.
Hey, Cal.
Welcome back.
Thanks for having me.
Oh, how are you today?
I'm doing really well. I've been following your advice, and I feel I've made a bit of progress. I'm a week without cigarette smoking, and I have been doing about 30 minutes of exercise every other day.
That's fantastic. How have you been achieving these goals?
Well, to help quit smoking, I've been chewing nicotine gum, and twice a day. And when I'm feeling cravings, I do some deep breathing exercises. And me and my husband have actually gone on 4 30-minute walks this past week. And we go together to keep each other motivated and to spend some more time together.
That's fantastic. I'm really glad you're doing this. You're really working towards improving your health, and that's amazing. Have you had any problems with your medications in the past 2 weeks?
No, I haven't. You and the pharmacist explained everything very well. I've used the Ventolin 4 times in the past 2 weeks, and it's relieved my symptoms. I think I'm on the right track.
That's great to hear. If you have any more problems or any questions, feel free to come by. I'm more than happy to help.
Thanks, Cal. You were so much help.
The end.